Well, one of the, in the past, as dentists, we could really get away with sort of just kind of, I say, burrowing our head in the sand, so to speak, and kind of ignoring the rest of the world, especially in Western industrialized economies. Economies were always growing so well, population growth was doing very well, and economically the masses were all rising. It made life as a solo professional very easy. You could get away with just ignoring the rest of the world, and it didn't matter. And now we're much more in the same camp as all other businesses, in that suddenly we are competing with commoditization of all kinds of pricing, both with our services, just as if you're a product. We're competing with lots of other businesses selling all kinds of other things. So now suddenly, if we are still doing it the old-fashioned way and burrowing our head in the sand, we've got big problems. So you have to take it out of the sand and look around, assess the situation, and then move forward. I belong to a fair number of professional groups personally, clinical ones, as well as non-clinical groups. And the reality is that everyone's sort of so focused in their little worlds. If you're in a professional organization that focuses on a clinical technique, the leadership is going to be focused on that. Their mission is to advance the concepts and the training of that discipline. And they're not really focused on these bigger picture issues. They may know that yeah, the dentists out there are having hard times finding patients, they're having a hard time having patients go into treatment, but they're still just focused on the needs of that organization, so they don't really go out and seek answers to these kind of problems that we're solving as an organization. Most dentists coming in, the majority of dentists out there who are successful have had experience with multiple consulting programs. It's the way it is. They've gotten advice on different problems in their practice, and usually at some point they leave that consulting program and then they realize that there's other things that they need to know. Invariably what we find is that most of the programs out there that are administrative in nature, that either put the practice in the right amount of staffing or the right amount of hours, those kinds of things, so like more management consulting, we find that what's left out of the equation are giving you promotional tools and tools to sell with, case acceptance training. By and large, all the other consulting programs do a great job of dealing with those other things, but yet they leave you sort of still standing there going, okay, I still need to find patients. I still need to learn how to sell better to those patients. So that's really how this meshes with anything else that you might have done. And of course, for some doctors, they were naturals at those other things. Maybe they didn't need consulting for basic practice management, but they still now wind up at a spot where they say, well, I still need promotion, I still need help with selling. When you're in a highly competitive market, you're actually you're in a unique situation. Let's say you're in a Manhattan. It doesn't get much more competitive than that. And those kind of doctors and environments, they want to believe they're in a unique situation, and it is. They really are. And I will again sort of break the news softly to those kinds of doctors, and that is, you have to do more than all of your other competitors, and you have to do more than what most people have to do in their less competitive environments. You have to be better at people skills. You have to be better at personal liking. You have to know more science of influence and persuasion. You have to have better videos. You have to have better patient testimonials. Everything has to be better in those environments. Now the good news is, if you're willing to do that, you get results. But if you're not willing to do that, then you just have to either say, hey, that's what I'm going to get in this environment, or I got to move somewhere else. I hate to break the news to you, but anything that's going to create more success in your business, whether it's related to promotion, management of your staff, inspection of your staff, growing the business, putting into place a systematic sales process, whatever it is that we're going to hand you for your success, it's going to take work. I mean, unfortunately, there's no way around it. If any of us had discovered some magical way of making money, making success without work, we would be selling that as well. But the truth is that for any of us in any of our businesses to get more at what we want from them, it's going to take work, and we have to realize that. And in fact, for dentists who can't say that I'm going to work on the practice, really you shouldn't be involved with what we're doing. And the other part is, you can do a lot of work in the business and still be ineffective. You can spend time, lots of wasted time, working on things that don't matter. And essentially over the years, what I discovered in my personal practice, and then of course as we've distributed this out to the world and we see it working in practices all over the place, is exactly what work matters and what should you be working on. So that's really one of the other benefits, is these are the things you should be doing that make a difference. You can forget about all the other things you were probably thinking about. So it really sort of helps you focus on what work's important and what work's not. You know, I think one of the last times that I saw Sir Richard Branson at an event, you know, even he said that 25% of his time was spent thinking about items and working on the businesses. And if that guy is doing it at 25%, there's no way around it that we don't need to be doing the same thing. The thing that's really missing, and again, this is no slight to any of the large, big names in the profession who really consult to the masses, that I say, and that is usually they don't really leave the practice with any ability to find patients, teach them how to promote, give them tools for long-term promotion, as well as give them a process to actually effectively sell no matter what the market's doing. If the economy's bad, the economy's good, you know, a system they can sell with for decades. So that's the thing that's left out of most consulting programs. Most of our dentists actually have some sort of accreditation. They may have a fellowship or two. We have a fair number of diplomates. It's likely that we have more diplomates that are members of our organization as a consulting group than any other consulting group. We don't teach clinical topics because certainly there are so many venues for you to get that material. However, the fact that you've got so many highly trained clinicians and clinicians with decades of experience treating some amazing cases who have something called perspective. You don't interact with that many careers who have that many colleagues who actually have what I call perspective, which is a long-term history on a procedure or a subject matter. And when you get around those kinds of dentists, you have immense wealth of knowledge clinically that you can draw from. So if you do have a case question, the odds are you actually will find an answer to that at one of our meetings. Again, it's not something that we really intended to be there, but it's a kind of a bonus side effect of having the right kinds of doctors get together. Well, you know, it's one thing to be recognized by your peers for your educational efforts. It's a wonderful thing. In fact, personally, I have several fellowships that I worked very hard for, that I studied for, that I took tons of courses for in order to get to attain those designations. The truth is that our patients really don't know anything about any of that. And if you don't give them the tools to understand what that means, they'll never know what it means, and they won't know how that makes you special or why that makes you any different than anyone else. So just because you might be, you know, one diplomat of an organization that only has 50 on the entire planet, by and large the patients won't know that that's special unless we give you the tools to tell them how it's special.